Jeff here again today. Today we're actually going to talk about the flu shot, and I mean, lots of questions this time of year about should I get the flu shot, should I not get the flu shot. Well, let's just talk about what the flu is first. Flu is actually a virus. Circulates around, it can go from person to person. Symptoms of the flu, generally you'll be fatigued, all your joints hurt, you're very tired, you have a sore throat. Some kids will vomit or throw up, but that's not typically what you'll see with a typical flu type of a thing. Difficult breathing, just feel crappy. And that's what the flu is. It can last between a few days and a few weeks for some people. Now, the vaccination that you would get that the government provides for you is just basically a concoction of what they think the flu might look like this year. The flu is a virus. A virus is made up of a body, a head, and a tail. And with a vaccination, they look at the tail and they cut that piece off and they actually give you the tail. So it's a very specific type of immunization you get only for that particular flu. And what happens is the year before, a bunch of people get together, they try and figure out what type of flu is going to be around, and they make a specific antibody for that flu. You cannot get the flu from getting the flu shot, but you can get the flu even though you get the flu shot. The Center for Disease Control in Atlanta just published a paper out saying this year's vaccination will only be effective in 50% of the people. That's because the primary flu that's out there right now is not in the flu shot this year. So you can still get the flu. Who should get the flu shot? Well, anybody that has a suppressed immunity, whether it's you're older, you're younger, you're on radiation, chemotherapy. If you're working with a lot of people that may get the flu, so if you're in an old age home or work in the hospital, you may want to think about getting the flu shot. Are there any side effects of the flu shot? Well, depending on who you are, some of the flu shots are made out of a chicken stock, or what else could it be made of? Dairy products, eggs. So if you have an allergy to these types of things, you may not be able to get the flu shot. There's also toxins in it, such as mercury and other types of things that suspend the vaccination in there. So it's really important that you talk to your family doctor or a nurse practitioner before you get the flu shot as to whether or not you are a candidate and should not get the flu shot or should get the flu shot. There's lots of other things you do to prevent the flu for you. One thing is get plenty of rest. Rest is very important because that's when the body repairs itself. So you need to get 7 or 8 hours of sleep a night. Exercise is very important, not real heavy exercise, because heavy exercise actually fatigues you and fatigues your immune system. So moderate exercise every day, 30 to 60 minutes every day would be very good. Drink plenty of fluids. Fluids flushes the body out, very important for getting the flu. You can also look at different foods. Foods such as vegetables and fruits that have lots of antioxidants in them. Dark chocolate's good for you. Sardines, oranges, olives, things like this are all good antioxidants for protecting you from the flu. Making sure that in the winter you're getting either sunshine or multivitamins, multiminerals to make sure your immune system's boosted up. Also, you may want to make sure you wash your hands frequently, because most people pass it by shaking hands or sneezing into their hands and not washing them. So washing your hands quite frequently is very important. As part of this this video, I'm also attaching a slideshow to the page that has 3 or 4 slides on that you can look at as to different types of foods, different types of ways to prevent the flus, and try and stay healthy. So this is Dr. Jeff. Share my message. Thank you.